Are you about to step into your first physiotherapy interview? Don't just prepare answers, prepare confidence. In this video, you'll hear 30 realistic interview questions and how to respond like a true healthcare professional. Let's get you ready to land your dream role in physiotherapy. Let's start with you. Tell me a bit about yourself.
Sure. I'm a newly qualified physiotherapist with a strong academic foundation and hands-on clinical experience from hospital and outpatient settings. I'm passionate about movement rehab, patient care, and evidence-based treatment. I love working as part of a team to help people regain function and improve quality of life. What inspired you to become a physiotherapist?
I've always been interested in human movement and health. After seeing how physiotherapy helped my grandfather recover from a stroke, I realised how impactful the profession is. I love the combination of science, hands-on care, and the chance to build long-term relationships with patients. How would you deal with a patient who's not motivated?
I try to understand the root of their resistance, maybe fear, pain, or lack of understanding. Then I'd adjust the plan, set smaller achievable goals, and educate them on the benefits. Building trust and showing empathy is key to getting them engaged. How do you build trust and rapport with your patients?
I listen actively, make eye contact, and explain everything clearly. I always ask about their goals, not just their symptoms. When patients feel heard and involved in their care plan, trust naturally builds. What would you say are your greatest strengths?
I'd say empathy, communication, and problem solving. I adapt quickly to each patient's needs and stay updated on treatment approaches. I also thrive in multidisciplinary teams and always keep patient-centered care as my focus. Which physiotherapy techniques are you most comfortable with?
I'm confident with manual therapy, therapeutic exercise prescription, and functional training. During my clinical placements, I worked with musculoskeletal, neurological, and post-operative cases using evidence-based interventions. How do you keep your skills and knowledge current?
I regularly read peer-reviewed journals, attend webinars, and follow research from reputable bodies like the CSP and APTA. I also learn a lot from case discussions with senior colleagues and mentors. How do you feel about working with doctors, nurses, and other therapists?
I really value teamwork. Collaboration ensures the best outcome for patients. I always communicate openly, respect other roles, and make sure my input as a physio complements the overall care plan. Tell me about a time you had to change your approach with a patient.
During my ortho placement, a patient struggled with standard exercises due to unexpected pain. I reassessed, modified the routine, and added more manual therapy. Their progress improved, and they felt more confident and involved in their rehab. How do you manage stress in a busy clinical environment?
I stay organised, prioritise tasks, and take short moments to breathe and refocus. I also try not to carry work stress home. Talking with colleagues and maintaining a healthy work-life balance really helps. What would you do if you had a disagreement with a coworker?
I'd handle it calmly and professionally. I believe in addressing issues early through respectful conversation. If needed, I'd involve a supervisor, but only after trying to resolve it privately. A good team culture starts with open, honest communication. Tell me how you prioritize your workload when things get hectic.
I assess urgency first, like post-op patients or those in acute pain. Then I follow the schedule, communicate delays, and stay flexible. Good planning and teamwork help ensure all patients get the care they need. If a patient isn't improving, what steps would you take?
I'd reassess their condition and treatment plan and consult with colleagues or specialists if needed. It's important to involve the patient too, understanding their goals and barriers. Sometimes a small adjustment makes a big difference. What's your approach to managing patients in pain?
I first validate their experience, then tailor treatment to their comfort level. Pain education is key, helping them understand that movement, even when uncomfortable, is often part of recovery. I go at their pace while keeping goals realistic. Rehab can be tough. How do you support your patients emotionally?
I listen without judgment, show empathy, and celebrate small wins. I also try to keep things positive and motivating, even when progress is slow. Emotional support is just as important as physical rehab. How do you simplify medical info or exercises for patients?
I use plain language, analogies, and physical demonstrations. I check in frequently to ensure they understand and feel confident. If they're not getting it, I adjust my explanation or use visuals. Are you confident with documentation and clinical records?
Yes, I understand the importance of timely, accurate notes. I've used both paper and electronic systems during placements. I make sure documentation reflects treatment, progress, and any red flags clearly and concisely. How do you respond to constructive criticism?
I welcome it. I'm always looking to improve, and feedback helps me grow. I listen carefully, ask for examples if needed, and put it into practice. It shows others I'm serious about being the best I can be. What's your favourite part of being a physio?
Helping people regain their independence. It's amazing to watch someone go from pain or limited mobility to walking, running, or returning to daily life. That transformation is incredibly rewarding. Do you have a preferred patient population?
I'm open to working with all types, but I've really enjoyed musculoskeletal and neuro patients during my training. I like problem solving and personalizing treatment. It keeps every day interesting. What would you do if a patient refused to take part in their session?
I'd approach them with empathy. I'd ask why, listen carefully, and try to understand their fears or frustration. I'd then adapt the session or start with something small. Respecting their autonomy builds trust and opens the door to progress. What if a patient doesn't speak the same language as you?
I'd use simple gestures, visual aids, or translation tools. If available, I'd request an interpreter. Clear communication is essential, and I'd do my best to ensure the patient feels understood and safe. What's your strategy for working with pediatric patients?
I use play-based techniques and turn exercises into games. I involve the parents, use colourful tools, and make sessions lively and positive. Kids respond better when they're having fun. What do you think separates a good physio from a great one?
Empathy, adaptability, and a hunger to learn. A great physio listens deeply, keeps up with new research, and adjusts treatments based on each individual. They inspire trust and keep the patient at the heart of everything. What if a patient becomes emotional in your session?
I'd pause the session, give them space, and listen without judgment. Emotions are a natural part of healing. Sometimes people need support more than stretches, and I'm there for both. How do you involve patients in setting goals?
I ask what matters most to them, whether it's walking the dog again or getting back to work. Then we create realistic, measurable goals together. Shared goals boost motivation and results. Tell me about a time you made a mistake as a student.
Yes, early on I missed a red flag in a patient's chart. I informed my supervisor immediately and learned the importance of double-checking notes. That experience made me more diligent and cautious. What if a patient made you uncomfortable?
I'd stay calm, set clear boundaries, and document the incident. If necessary, I'd report it to my supervisor. Safety and respect must be maintained for both patient and practitioner. What keeps you going when things get tough?
I remind myself why I chose this career, to help people heal. I reflect on small wins and lean on my team when needed. Even on hard days, there's purpose in every session. Where do you see your physiotherapy career heading?
I'd love to build deeper clinical expertise, maybe specialise in neuro or sports rehab. I also hope to mentor students and contribute to research. I see myself growing while always keeping patients at the centre. Now you've got the words, you've got the presence, and you've got the heart of a healer. Step into that interview with confidence, because your journey as a physiotherapist is only just beginning.